Hi, my name is Sasha Jovanovic and welcome to my lecture on soft tissue management. This lecture will focus really on 10 criteria which have to do with the soft tissue stability and the soft tissue predictability we do in cases. And there's so many factors we're dealing with in clinical practice. I mean, the success rate of soft tissue has to do with like implants, it has to do with like abutments, it has to do with the team we find, it has to do with the new sciences. There's so many factors we have to do. So, and when you look at it, really what do we want? We want invisible results. So this lecture will talk about how to get to these results that we have really the predictability in the margin. And when do we do grafting? When do we do flapless? And when do we do an abutment with a temporary shape which is optimal? Or when do we do maybe like, a final abutment? So all these things are important for us. Then, how do we do all these patients? There's so many patients in our practice which come in with fractured teeth, unfortunately sometimes internal resorption. How do we get predictability? So this lecture will focus in on like minimal invasive procedures to really come to a result which is at least as good as before and sometimes even better. And then of course you have to think about soft tissue grafting. There's a lot of new periodontal techniques which we can do. This lecture will talk also about some of these minimal invasive connective tissue grafting techniques where we can improve volume. And last but not least, we have these patients which have no papilla sometimes. And then what do we do? And there's some unique criteria when we think about bone, when we think about soft tissue, and even about growth factors, how to bring the papilla back, like in this case. So come and watch this lecture as soon as you have the time and take the pearls which come here, which I've learned over the last 15 years. Thank you.
For more education programs, visit the Guide Institute at www.guidedental.com.